PA ALICE report was released in June of 2019. So United Way of Franklin County, we've been across community since then to tell the story of ALICE in Franklin County. Now, just this year in January, United Way has released the 2020 ALICE report refresh, which is now based on more current data, which is 2018 total population data. And this is because of the methodology used. The total point in time data will have all of the data we need. It'll always be kind of 2 years behind. So also in January, the COVID-19 impact on Pennsylvania, the ALICE story report was released. So since the most current ALICE report has data before COVID, this survey was released across Pennsylvania to help use the ALICE data and the survey together to better tell a picture of how ALICE is faring as we're moving through COVID. And that survey saw nearly 2,000 Pennsylvanians respond to it, both ALICE households as well as those above the ALICE threshold. So my goal today is to help you all better understand the challenges that our local households are facing during COVID-19. It will be a lot of data in a short amount of time, so bear with me. My hope is that this research can help you all identify the most vulnerable in our communities and help direct programming and resources to assist households throughout the pandemic and the recovery that follows. So an overview of ALICE, again, this may be repetitive for those of you who are familiar with it, but for those of you who might need a refresh, ALICE stands for Asset Limited, Income Constrained, Employed. ALICE holds low-wage jobs in our community. They earn above the federal poverty level, but below the household survival budget, and they have no savings for emergencies or for investing in the future. ALICE households cannot afford all of their basic needs. This includes transportation, childcare, rent, healthcare, groceries. So they have to choose between these essentials month to month. I'll go over a few key terms that I'll talk about as I go through the data so you have an understanding of what I'm talking about. The first is ALICE. When I mention ALICE, these are households that are above the federal poverty level, but below the basic cost of living. And that basic cost of living is the household survival budget that is identified in the ALICE report. Poverty households are earning below the federal poverty level. And then when I talk about the ALICE threshold, which this comes up a lot in the survey because the survey breaks out the groups into those below the ALICE threshold and those above the ALICE threshold and comparing their answers from the COVID impact survey. So those that are the ALICE threshold, if you're on the threshold, is the household survival budget. So that household is meeting that exact household survival budget. If you are below that, then this includes both ALICE and poverty level households. If you are above the ALICE threshold, then you are earning more than the survival budget. In Franklin County, 33% of our households can't afford their basic household necessities. So they are below that ALICE threshold. Of this, 11% live below the federal poverty level and the other 22% are ALICE. So what does this ALICE data help us to tell? It helps tell the true number of households that are struggling that we don't know just from that 11% of the federal poverty level. So we know that through the report, 33% of households need assistance, yet most of them don't qualify for the majority of programs, and at least programs that are funded through government that use the federal poverty guidelines. So I've mentioned this household survival budget. If you were in the session with me before, we really drilled down into some of the details of that. I won't be doing that in this session, but if you're interested, you can always check out our website, uwfcpa.org/ALICE. This has more details about the data, the survival budget, and some of the general information based on that 2018 data in the 2020 report. But what I will start to dive into is really ALICE during COVID and understanding the impact that the pandemic has had both locally and throughout the state. So 33% were moved, February 2020 of last year, 33%, it can be assumed about 33% of households in Franklin County were already vulnerable. They had no money for emergencies saved. So then you come into March of 2020 and you throw in an unprecedented crisis in a global pandemic. The economic impacts of COVID-19 continue to reverberate, from unemployment to closed businesses to the halting of goods and services production. All of these things have led to millions of families dealing with a reduction of income. So that 11% of Pennsylvania households throughout Pennsylvania, there's been 11% that have been like on the cusp of the ALICE threshold. And so really all we can be led to believe through the pandemic is that the number of ALICE households and households that are struggling to survive is only expected to increase as the pandemic continues to impact our communities. When it comes to COVID-19 issues and their greatest concerns, the majority of ALICE households report that their top concern during the pandemic is paying for housing. While in contrast, the majority of households that are above the ALICE threshold are most concerned about contracting COVID. So you can see when your basic needs are met, you have that ability to be able to worry about the virus and worry about the pandemic and how it will affect the health of you and your family. When your basic needs aren't met and you're still trying to afford those needs, then you're more worried about meeting those needs and less likely to be able to have the capacity to worry about the virus. 52% of ALICE households are concerned about eviction or foreclosure on their homes, but only 26% of ALICE households have sought housing relief and assistance. Now, this was as of the release of the report, which was in January. And I know that there's been more funding allocated. So the hope is that number is increasing, but as of the time of this data and those respondents to the survey, it was 26%. So ALICE families that have lost income may not be able to catch up once rent and mortgage freezes are lifted, which means that they could be at risk of losing their homes. And this is a common topic that is talked about a lot, how the impact is on rentals and evictions and what is going to happen as we continue to figure out how to navigate this pandemic and what the response is going to be to support the landlords as well as the residents of those. So with a reduced income, it will be even harder for ALICE families to afford the basics of the household survival budget. From the COVID impact survey, 77% of respondents with a household income that's below the ALICE threshold had 1 month or less of savings. In contrast, you had the majority, 63% of respondents that are above the ALICE threshold indicated they have enough savings for 2 months or more. So when families have had to turn to means other than income to try and meet their monthly bills for basic needs, the COVID impact survey revealed that just over half, 52% of respondents with a household income below ALICE threshold had applied for unemployment. 37% of those below the threshold had borrowed money from friends or family to make ends meet. 36% had applied for government assistance programs, and 23% increased their credit card balances in order to pay their bills. Food insecurity is another one of those issues that has really been highlighted and heightened throughout the pandemic. 43% of respondents with ALICE households, of households that are below that ALICE threshold, reported utilizing food banks or pantries. And that's compared to only 15% of those that are above the ALICE threshold. Respondents with households below the ALICE threshold report being unable to afford food at a rate of 58%. That's almost 3 times that of households that are above the ALICE threshold. So when you have just over half of total households unable to find the needed amount of food for their families, and that was during really the height of when we were experiencing food shortages due to demand as well as supply chain issues. So all households were having trouble finding the food they needed to purchase in grocery stores, but certainly families under the ALICE threshold were having trouble affording the food that they needed. Now, families with children have been navigating additional challenges from the pandemic. School closures have had a significant impact on families and students, causing disruptions to their routines. It's impacted their socialization, their nourishment, and their learning environment. So for many families, losing the free and reduced price lunches and access to education have been difficult. For some children, school is their one safe place. Sheltering at home can lead to unsafe situations in families where there's neglect or there's abuse. So for parents, the ability to work from home can often be limited when they need to care for children and assist with remote learning. The digital divide, which I'll talk about a little more later, is another challenge. ALICE households are less likely to have access to high-speed internet or digital tools. So with less access to internet and computers, ALICE children are having a difficult time participating in online learning, and parents are having more difficulty working remotely if that's even an option that they have based on what they do for employment. In terms of childcare, the survey revealed that total households with children, over half have adjusted their work to accommodate their family's need for childcare. Over half. So 64% of respondents with households that are below the ALICE threshold report either reducing their hours or leaving their job. The top 2 reported childcare concerns and issues for families are helping children with distance learning, that's just over 50%, and juggling work and children's needs is at 50%. So those are the 2 top concerns for families with children. The health risk for children and household members was also a great concern. Now, seniors, as we know, have been the most vulnerable age group during the pandemic. In Franklin County, 44% of senior households are below that ALICE threshold. So that's more than the average for if you take the total population household into account. So due to age, underlying conditions, and often living in group quarters, such as assisted living facilities or nursing homes, those over age 65 were more susceptible, well, I'll say are more susceptible to getting or dying from COVID than the general population. We'll say again, since this report, we've had the vaccine distribution going out, which has greatly improved the risk for seniors. But in terms of this data, I'm really focusing more on pre-vaccine information. So this increased vulnerability, as well as the closing of senior centers, which they're starting to reopen, but a lot of senior centers still are closed or have greatly adjusted how they are bringing their seniors in for socialization and services. Closings or changes in how houses of worship reach out to their congregations, and as well as other community organizations, changing or adjusting how they do things. It's really heightened the anxiety and the isolation among the senior population. So that rapid decline in the stock market has also drastically reduced income and resources for many seniors. In addition, some supply chains have been disrupted, and many still continue to be disrupted, impacting the availability of generic prescription drugs that are more affordable and other necessities that seniors really rely on. So this means seniors are a high-risk group, both in terms of their health, but also in terms of their finances. So let's look at ALICE in the workforce, because ALICE has played essential roles that are crucial to our economy. I think just the term essential workers that really came out of the pandemic shows how much we rely on these low wage yet high risk earners to keep our economy going. So many of these ALICE workers do not have basic employee protection, such as an annual salary, such as health coverage, paid sick leave, and other benefits. And all of these would help them withstand not just normal life, but then also when you're entering into a crisis such as the pandemic. So on one hand, we said these jobs are deemed essential now, and the employees are asked to report to work despite the risks to their health. But on the other hand, many of the jobs have been seen, and even now continue some to be seen as dispensable, where workers have their hours cut or they're laid off, they lose wages, they earn lower wages than what living wages might be during these times. So what we know through data is that 65% of workers in Pennsylvania are paid hourly. These workers are more likely to have fluctuations in their income during the best of times, let alone during a pandemic. Many essential workers also now have additional family caregiving responsibilities, whether that be a child needing to learn at home or having inconsistency in their virtual learning versus in-school learning, or just having an older relative that they need to take care of within their home now. So with no safety net, they have no choice but to work. This all leads to higher levels of stress. So now let's talk about non-essential workers that are still ALICE workers. They're facing job insecurity and possibly long-term unemployment. The stores closed, events canceled, and businesses closed. Families are losing income, and it's going to take time to ramp up back to the job market that we once had. Even now, we know Governor Wolf just announced that everything except the mask mandate will be lifted at the end of this month. Even with that, we're seeing now, while jobs are open and available, they're not, certain industries are having a hard time filling those open positions. So it's going to take time to get back to the job market where we were before, not just in terms of job availability, but in terms of the labor force being able to fill those positions, and whether that be because of responsibilities they now have at home, of changes they've had to their responsibilities in the household, or otherwise. Oh, I'm going to go back because one thing I missed was talking about non-essential workers, job insecurity, and a lot of, as we know, a lot of positions that were able to change to working from home, remote work. Well, that is more difficult for households that are below the ALICE threshold because, like we talked about with the digital divide, they may not always have access to internet and technology to be able to work from home. So sometimes that's not even an option for those below the ALICE threshold. So from the survey, we know that 70% of respondents below that ALICE threshold indicated changes in employment due to the pandemic, which include loss of job, being temporarily laid off, and changing jobs. Whereas 59% of households above the ALICE threshold, so still high, but less, they reported no changes to their employment status. So the majority above the threshold had no changes to employment, whereas 70% of ALICE threshold had changes to their employment. Of respondents below the ALICE threshold, almost half, 46%, are fearful of a reduction in work hours or wages. 38% fear losing their job. And the majority of all respondents are either somewhat or very uncomfortable with being at the work site full time, indoor dining, indoor friend gatherings, whether that be personal gatherings or community group gatherings, such as at churches, as well as being on schools or college campuses. Now, again, this survey was before the vaccine rollout. While I don't have data since then, a survey was just done in the past 2 months, a similar survey to get some more updated data. So I don't have that data yet, but we hope to have it within the coming months that we can report on ALICE during COVID within the vaccination rollout. So now I'm going to talk about the inequalities that have really been shined a light on throughout all of this, and not just because of the pandemic, but because of other national events that have been going on in the past year plus. What we know from the ALICE report is that all households, or households of all ages, genders, races, ethnicities, living in rural, urban, suburban areas, they're all impacted by the pandemic. but groups that are disproportionately ALICE will be impacted even more severely. So one of those groups one of the areas that indicates kind of the ability to be able to better weather something such as this pandemic is a socioeconomic gap. Income, occupation, and education have all been impacted as we've been dealing with COVID-19. Those with less socioeconomic standing have generally been hit harder. So with less means to navigate a crisis, you are more likely to have issues or other barriers come up. Now, being able to isolate in place is a luxury that not many ALICE families can afford. Differences in income and savings really also determine who can stay home, who can buy protective gear, cleaning items, other essential items, toilet paper, and take time off of work when they're sick, as well as access quality health care. ALICE families without savings and working hourly paid jobs are more likely to fall into debt and may not be able to protect themselves or afford treatment if they get sick. Many ALICE families have been skimping on essentials for years, from healthy food to routine health care. So this leads to disparities in health and access to health services. Along with the added stress of living paycheck to paycheck, these factors increase the risk for chronic health conditions, making ALICE more vulnerable during the pandemic. Initial reports showed that groups that have underlying health conditions face persistent discrimination in healthcare services or live in areas with fewer support services, such as rural areas, make up a higher proportion of COVID-19 deaths. Medicaid and employer insurance are essential for households that are below the ALICE threshold because loss of work could take away the crucial benefit of health coverage, posing a significant additional burden for many ALICE families. Now, when we talk about marginalized populations, we know from the ALICE report that many marginalized populations have lower incomes and are therefore more likely to live in ALICE households. These groups include people of color, women, LGBTQ+ people, those with lower levels of education, those with a disability, recent undocumented, unskilled, or limited English-speaking immigrants, younger veterans, and formerly incarcerated people. So a few examples: for Black and Hispanic households, median earnings are lower and the unemployment rate is higher. People with past convictions are more likely to be unemployed or to work in low-wage jobs. And women, who make up nearly half of the US workforce, receive more college and graduate degrees compared to men and are the primary or equal breadwinner in 40% of families, yet their wages are generally significantly less than men in comparable jobs. These disparities all add to more barriers for these marginalized populations to move into financial self-sufficiency. So now the digital divide that I've talked about a few times now, we know the COVID pandemic has really emphasized that divide that exists for households that are below the ALICE threshold. 81% of ALICE households reported additional costs for increased utility use and purchasing of technology that they needed to adapt to the stay-at-home orders last year. So additional costs for these ALICE households are really alarming and concerning when you consider that ALICE household survival budget doesn't include any budget for savings or for extra spending. Through the ALICE report, we know the data tells the benefits of moving towards equity. If all households earned enough to meet their basic needs in Pennsylvania, the state economy would grow by 17%. So when everybody can afford their needs, the economy is better, and that helps everyone. The impact of COVID-19 has been really revealing the opposite of that. When the number of households that can't meet their basic needs increases, then economic hardship also increases for all of us. It's really the true definition of equity, right? When everybody is given equitable resources to meet their needs, everybody comes up. When it's not, then everybody is weighed down by that. So we talked about things that you can do kind of through the questions. Advocate, volunteer, and give are really, I mean, if you do any of those things, all of those things, you're going to benefit our local community and you're going to help serve ALICE families. Diving a little bit more into some of the policy, because again, I mean, community coming together to fill gaps and bring more programs forward is important. I don't want to underestimate that. But real big change isn't going to happen unless policy change happens. And this is, this is policy that is going to lift ALICE up. Kind of like we talked about, if ALICE gets lifted up, then everybody gets lifted up. So United Way, Franklin County works with other local United Ways, as well as the United Way of Pennsylvania, to advocate on behalf of our community with our state and national level leaders to adopt these policies that will reduce burdens that ALICE encounters and help move them on their journey to financial self-sufficiency. So the policies that we really highlight in our legislative agenda for ALICE is first investing in PA 211, what we talked about, that referral, the Human Services Referral Hotline is really helping to alleviate barriers by connecting people to resources to overcome those barriers. So if we invest state funds and also use the data that gets collected through PA 211, we're just going to be able to continue improving health and human service planning at the state level. Workforce development that works for ALICE. We know when every individual and family is stable, we have more opportunities for economic mobility, and that makes our communities stronger. So we need to really work on increasing family sustaining employment and assuring that access to income supports and emergency services can help all families. Accessible and affordable childcare in pre-K is also huge. Research shows that high quality childcare in pre-K improve a child's ability for school achievement. So while childcare providers can be far and few between at times, or they have big waiting lists, or not to mention they can cost a lot of money, at the same time, childcare is critical for working families to earn an income. So we need to invest in these programs that aid in the first 5 years of a child's life, while also reducing that burden on a family to pay for that quality childcare. The well-being of families in prenatal age to 3, families, kids are babies, they are tomorrow's future. And so we need to ensure the success of child development through the prenatal and child healthcare, nutrition, and community assistance. And of course, supporting households through the recovery. Now more than ever, we need to have an investment in health and human service programs to help demonstrate positive outcomes and help provide that basic safety net for service for Pennsylvanians that they need. As we're going through the vaccination efforts and everything, hopefully we're nearing the end of the real rough parts of the pandemic, but that support is going to be continued to be needed by families that are below that ALICE threshold. So those are really the business or the government actions that we're advocating for, and we invite you to join us in that as well. There's business actions I could go over. Just quickly, I think that it's important as employers, as we need to recognize that we employ ALICE families. And so we need to just be really conscientious about the benefits and the flexibility and being creative about how we can support our ALICE employees. So if you have any questions or anything, please follow up with me afterwards. Or even if you just want to get connected into anything that I talked about or learn more about United Way and anything we do, please feel free to contact me.